I'm here today with the opportunity to talk to you just a little bit about an evidence-based approach to shade communication. I teach part-time on the visiting faculty down at the Pankey Institute in Key Biscayne, Florida, and I've been asked by Vidant out in Brea, California, to talk with you about some of the new information that's available. And I have to laugh because right away when I say new, it's almost 10 years old, but some of the newer information that's available to us that helps us better define a language and a protocol that we can use to talk about shades in restorative dentistry today. What's really unique for them and really brings me to the forefront of this kind of discussion is the fact that what we're talking about here is really an improvement of a shade guide that Vidant brought us some time ago. Now, if I laughed about the 10 years on the newer side, I'm going to laugh even louder because in 1956, same year that I was born, I know that's right, thanks, I don't look 50, but I am. In 1956, the Vidant Corporation brought us a shade guide that revolutionized shade taking for us in restorative dentistry. The Vita Classic Shade Guide is incredible. It's been used across all phases of dentistry throughout every restorative material, denture teeth, composites, porcelains. It's been the standard of care. It's been the standard language for shade for us in dentistry for 50 years. Yet when I was in dental school, graduating in 1981, I'd never heard of this. We were using the Nu-Hew and the BioBlend shade guides. I didn't hear about this till I was out in private practice. That's 25 years from the time this shade guide came on the scene in Germany. I still hadn't heard about it in my dental school education. In 1998, the same company that brought us this gave us the 3D Master Shade Guide. This shade guide gives us a larger number of choices. Not only that, it's designed and organized from value to chroma to hue. The very same ways that we should be using and adapting our eyes, our visual performance criteria for picking and selecting and matching shades in dentistry. It's really a value, chroma, and hue orientation that we want to approach with today. In fact, we're going to make a case for how this neat company is actually replacing its old product line, its old shade communication methodology with a new one, and how it's a more scientific, more evidence-based approach to that kind of utilization. Currently, the American Dental Association defines evidence-based shade or evidence-based dentistry in this way. The evidence-based communication framework that we're going to use today is taken directly out of the language from the American Dental Association's definition of evidence-based dentistry. The three parts of that definition that I'd like you to focus on are the systematic assessment of clinically relevant scientific evidence. See, it's a systematic assessment, not an arbitrary assessment, as we're going to see comes into play when we look at this shade guide, which was developed, I guess, told you in 1956 by a denture technician who didn't like the way the other shade guides looked. So that individual took a stab at using his porcelain powders and creating what he thought looked more lifelike in terms of shades. He did an admirable job. Systematic assessments of clinically relevant. We have to be able to apply this information in a language and in a protocol of taking shade that makes it predictable. I'd like it to be easier for us, more accurate, and more lifelike in terms of how it's going to look in those restorative solutions that we provide to our patients. And finally, it has to be based on scientific evidence. We can't just say arbitrarily or willy-nilly that this looks good or this doesn't look good. We know and understand now scientifically so much more about color than we did in 1956. So when Vidant came out in 1998 with a, dare I say, systematic assessment of clinically relevant scientific evidence, they brought us the 3D Master Shade Guide. Currently, what we use to apply that information, or any information about shade though, are these. We use our eyes. And that's a wonderful tool, but it is fraught with compromise, innuendos, perceptive tweaks, and all kinds of things that can mess up what we think we see. See, the eye takes in information, light reflectance, and it transmits it through a number of neuronal impulses and synapses, and then up to the cerebral cortex for interpretation. So there's all kinds of information that's being processed and interpreted, and therein lies some of the problems. Some of the problems are mechanical in terms of how our eye works, and some of the problems are perceptive in terms of how we see, visualize, and think and react to color and information. The eye has two types of cells, rods and cones. You remember that from anatomy. The rods pick up the black and white. The color is picked up by the cones. CO, cones, CO, color. That's how I always remembered it when I taught anatomy.